Good morning, good afternoon, or good evening, everyone. My name is Brian, and I am accompanied by Doris, Gabriella, and Kimberly. And today we will be discussing healthcare access during the COVID-19 pandemic.
In this slide, I have provided a timeline of important dates from the year 2020 in regard to COVID-19. On March 11, the World Health Organization declares COVID-19 as a global pandemic. On March 13, President Trump declares COVID-19 a national emergency. On March 19, Governor Newsom of California issues a statewide shelter-in-place order to reduce COVID-19 transmission. The shelter-in-place order allows essential workers to go out for work, such as healthcare workers, transportation workers, bankers, grocery workers, and agricultural workers, to continue working. Individuals were encouraged to only go out for essential duties, such as grocery shopping and doctor appointments if needed. Some jobs were able to transition to do work remotely at work while being at home. Others were not. As a result of this, many people lost their jobs and consequently their health insurance that their employers provided. On April 15, Governor Newsom stated that the state of California will provide financial aid to undocumented immigrants who needed help due to the COVID-19 pandemic. On November 20, there was an increase in COVID-19 hospitalizations and ICU admissions. On December 14, the first vaccines arrived. On December 25, in the state of California, the ICU capacity is at 0%. There are no longer ICU beds available for these patients. On December 30, there are approximately 24,000 deaths attributed to COVID-19 and 2 million cases reported. The COVID-19 pandemic demonstrated flaws in the healthcare system in the United States. COVID-19 has affected racial and ethnic minority groups. Blacks and Hispanics are dying at a faster rate compared to whites from COVID-19. 1 in 10 people in the United States do not have health care insurance. The position statement that we came up with for healthcare access during COVID-19 is that nurses, nurse leaders, case management, and social workers should work together to provide resources to racial and ethnic minority groups during the COVID-19 pandemic. Racial and ethnic minority populations are disproportionately represented among essential workers, which might be contributing to the COVID-19 racial and ethnic health disparities that we are seeing. Resources that can be provided include providing information sessions on how to apply for health insurance, helping individuals apply for health insurance through Cover California, advocating for undocumented immigrants to seek medical care or testing for COVID-19 as soon as a symptom begins to manifest.
Supporting points. The COVID-19 pandemic has led to many layoffs, furloughs, and decrease in working hours, which in turn has led to a lack of appropriate health care access, affecting much of the population, especially minorities, low-income, and undocumented individuals. In May 2020, an estimated 27 million Americans lost employer-sponsored health insurance, which had an even greater impact on minority groups and low-income populations. Immigrants are also among the groups most likely to experience disproportionate effects from the COVID-19 due to ineligibility for public assistance programs. So undocumented immigrants are ineligible for federal public assistance programs, as are authorized immigrants in the first 5 years after they gain eligible status. Non-citizens that do get COVID-19 may also experience barriers to accessing healthcare because nearly 1 in 3 lack healthcare insurance coverages.
Hello everyone, my name is Kimberly Ramirez Solano. I'll be discussing the theory that we used to base our group project on. The theoretical basis for our group project was Salmon White's construct for public health nursing. In this theoretical framework, the client is the community, and the type of nursing practice is public health nursing. So what is public health? According to Mark Salmon White, public health is an organized societal effort to protect, promote, and restore the health of people. The goals for public health are to reduce the amount of disease, premature death, and disease-produced discomfort and disability. There are 3 practice priorities, according to Salmon White. He describes them as prevention, protection, and promotion. According to Craig Stotts, the 3 practice priorities defined by Salmon White are prevention, protection, and promotion. Under prevention, he describes it as strategies and actions that seek to reduce the probability of occurrence of disease and poor health to 0. For our group project, our strategies and actions are aimed at reducing the occurrence of COVID-19 infection in racial and ethnic minorities, as they have been disproportionately affected during the pandemic. Under protection, he describes it as strategies and actions that seek to minimize the impact or consequence of the occurrence of the disease and poor health resulting from exposure to the external agent. In this case, the external agent is COVID-19 infection. Racial and ethnic minorities are at a higher risk of exposure to it due to being considered essential workers. They have a limited access to healthcare, and they are more likely to have underdiagnosed underlying health conditions. These factors make it more likely for racial and ethnic minorities to develop a severe and potentially deadly course of infection. Salmon White describes promotion as strategies and actions seek to bring about gains in health status with respect to a specific health problem. Racial and ethnic minorities often work in industries in which paid leave is not offered, and where personal protective equipment or PPE guidelines are loosely enforced. Aside from that, they have difficulty with healthcare access. Therefore, health promotion strategies are necessary to improve the health status of these individuals.
We set up an interview with Mrs. Sarah Winder via Zoom. She's the director of patient care services at Loma Linda University Health, Marietta. During the interview, she talked about her leadership position and commented on bed shortages back in December during the COVID-19 pandemic. The image on the right shows a summary of the COVID-19 patients during December 29th, just 4 days after California had announced zero ICU bed availability statewide. In the interview, we learned that health inequities need to be addressed nationwide. As she mentioned, many of the COVID-19 patients did not have health insurance or had recently lost health insurance. She went on to mention that many of the COVID-19 patients did not seek medical care due to the fear of immigration status and deportation. She mentioned nurses, social workers, and case managers work tirelessly helping patients obtain insurance or emergency medical while being hospitalized for healthcare to be able to be provided upon discharge. She mentioned a patient's immigration status does not disqualify them from obtaining health insurance. There is some assistance available for these individuals. She mentioned that nurses in the emergency department never question patients about their immigration status and always offer reassurance that they can and would receive the care they needed. She went on to say that emails were sent out to employees of Loma Linda University, Marietta, on January and February to announce that the hospital would help mitigate the spread by providing a community COVID vaccination clinic so peers, colleagues, friends, and family members could get their vaccination since the hospital had a surplus of the vaccinations. She mentions that the vaccinations would help to decrease death and serious disease as much as possible, preserve the functioning of society, and reduce the extra burden that COVID-19 had already put upon the people who were facing these disparities.
This is an informational resource sheet that we can provide to the community on how we can help them apply for health insurance coverage, know which government programs you qualify for, so that the community knows what options are available for them and their family members. We can also explore resources that are available to help pay for medical expenses and prescriptions, and inform them about low-cost health clinics and programs. We also want to inform them that immigration status does not completely disqualify you for healthcare coverage, and also let them know that we're here to help filling out any appropriate forms, and the bilingual personnel will be available to answer any healthcare related questions.
Thank you for watching our presentation. In the following slides, we provide our references.